Hello, my name is Derek Forrest, and the topic that I will be discussing is the Affordable Care Act. The Affordable Care Act was signed by President Obama on March 23rd, 2010. The act is designed to provide affordable health care coverage for every American citizen. The act also should improve the quality of care provided to individuals while decreasing the cost of health care coverage. The Affordable Care Act involves individuals, families with children, individuals who have disabilities, pregnant women, senior citizens, young adults, and small business owners. For individuals who currently have health insurance, they will not be required to change anything with their current plans. They will be able to receive preventative health services without having to pay a deductible now. Preventative health services include cancer, diabetes, and blood pressure screenings. Contraceptive counseling and FDA approved birth control is also included. Young adults who are not able to obtain health insurance through their place of employment will now be allowed to stay on their parents' plans until they turn age 26. Regarding individuals who do not currently have health insurance, starting in 2014, health insurance can be purchased directly through an affordable insurance exchange. Affordable insurance exchanges are state-based competitive marketplaces for private insurance. If your employer does not offer health insurance, then you can purchase it directly through an affordable insurance exchange. The Affordable Insurance Exchange allows individuals to choose the coverage that is best for them at the best price for them. The exchange will be open to individuals as well as small business owners. The benefits of affordable insurance exchanges are that they provide a marketplace for consumers to compare prices and buy affordable health insurance. The quality of care provided by hospitals and physicians are available to the public through these exchanges. All plans offered by the exchanges are required to provide at least basic comprehensive benefits. Comprehensive benefits cover medical expenses such as doctor's visits, hospital stay, surgeries, and rehabilitation. Affordable insurance exchanges also provide a source to find answers for questions regarding health care coverage options. Information regarding health programs and tax credits for health care are provided by the exchanges as well. Assistance is provided for enrolling in the Child Health Insurance Program, also known as CHIP. CHIP is designed to provide coverage for children whose families make too much money to qualify for Medicaid, but they do not make enough money to purchase private health insurance. Assistance is also provided for enrolling in the Pre-Existing Condition Insurance Plan, also known as PCIP. This was designed by the Affordable Care Act for U.S. citizens that have been denied health insurance because they have a pre-existing condition and they have not had insurance in the last 6 months. Individuals who have Medicare also are affected by the Affordable Care Act. Senior citizens will now be able to receive free annual wellness visits. Annual wellness visits provide education and counseling about preventative services and the current health care that senior citizens are receiving. Seniors will also receive free preventative services. The preventative services include diabetes screening, flu shots, bone density tests, and cancer screening. Discounts are being provided to seniors who are not able to afford their prescription medication. Also, guidelines have been established to save money by fighting Medicare fraud. About $4.1 billion in taxpayers' money was recovered in 2011 as a result of these new monitoring techniques designed by the Affordable Care Act to help stop Medicare fraud. There were tougher screening procedures enforced based on new technology that tracks fraud trends and flags suspect activity. The Healthcare Fraud Prevention and Enforcement Action Team, also known as HEAT, was created to fight healthcare fraud as well. In 2011, the HEAT Strike Force Team was responsible for the largest ever federal healthcare fraud takedown of 115 defendants in 9 cities, which included doctors, nurses, healthcare company owners, and executives, for fraud schemes involving more than $240 million in false billing. Accountable care organizations were suggested by the Affordable Care Act as well. Accountable care organizations, or ACOs, are groups of doctors, hospitals, and other healthcare providers who voluntarily come together to provide coordinated care to Medicare patients. ACOs help provide better care for Medicare patients by providing an efficient, effective plan of treatment. The goal of coordinated care is to ensure that services are not duplicated and medical errors are prevented. The Medicare Shared Savings Program rewards ACOs that lower healthcare costs while still providing quality care to their patients. Creating quality care. If uninsured Americans are provided with affordable health coverage, then fewer people will delay or avoid seeking medical care because they cannot afford to pay for it. The new investments made in preventative health services will support doctors' efforts to maintain their patients' health through requested preventative services. There will be some limitations placed on insurance companies as well. Starting in 2014, the Affordable Care Act will make denying someone health insurance or charging an unreasonable price for health insurance because that person has a pre-existing medical condition illegal. The act will also stop insurance companies from being able to deny coverage to children who have asthma, diabetes, or were born with a heart defect. Insurance companies will no longer be able to cancel coverage when individuals become sick or because of errors that they have found in paperwork at a later time. There will no longer be lifetime and annual limits set on the amount of money an individual can receive for benefits. Insurance companies are also being required to justify raising premium rates by more than 10%. In Washington, D.C., the Democrats and the Republicans do not always see eye to eye on all of the facts regarding the Affordable Care Act. The U.S. Senate Republican Policy Committee believes that the law is harming small businesses by making it harder and more expensive for them to hire new workers because of the potential cost of required insurance under the new law. According to Republican Senator John Barrasso, states are being forced to take money from education in order to support the extra costs associated with the rising Medicaid costs and extra people who are being added onto Medicaid. Some insurance companies, including Blue Cross and Blue Shield, have stopped offering child-only health insurance policies as a response to the Affordable Care Act in an attempt to save money. They also believe that some insurance companies have asked for rate increases and claim that the policy changes and premium increases are directly related to the new Affordable Care Act. The U.S. Senate Democratic Policy Committee believes that health insurance prices will be kept low because private insurers will have to compete for the business of the informed consumers who are comparative shopping within the affordable insurance exchanges. Small businesses will also be able to benefit from the same purchasing power that large businesses currently have. The improvement in quality of care and service provided to individuals is a major focus that the Democratic Policy Committee believes will occur through the features enacted in the Affordable Care Act. Now, some thoughts that Americans have are that Insurance companies should not be allowed to cancel individuals' policies when they become sick with a serious disease. Some individuals also believe that people who do not qualify for current government health coverage because they have a job but they do not make enough money to afford health insurance also need some type of assistance as well. Americans should not have to go bankrupt or decide between medicine and heat in the winter because they do not have health insurance to cover their medical expenses. Is also a concern that some Americans have. Some wonder, is the law even constitutional? And should the federal government be allowed to make all Americans have health insurance? The question that is asked is, will the U.S. government be able to afford to continue to fund health programs such as Medicaid in the future with the extra burden that will be placed on them as a result of the Affordable Care Act? And by the year 2014, if you do not have health insurance, you will have to pay a fine. My final thoughts on it is that every industrialized country has some type of government paid health care for their citizens except for the United States. Most of these countries spend less on health care than the US, and they have a lower infant mortality rate. As far as the Constitution goes, it does state that government has the constitutional right to lay and collect taxes to provide for the general welfare of the people. Most Americans do not want government to have too much involvement in their health care, but if something does not change about our current health care spending and costs, then they will continue to rise until we can no longer afford them. There has to come a point when the American people allow the government to do what is in the best interest of all Americans regarding health care. I would like to thank you for listening to my discussion about the Affordable Care Act. Thank you.